Premier Baird is gone. Minister Skinner is gone. This proposal should be gone.
Tonight a huge amount of the community came here to the forum to find out answers.
People are angry that this is a community-built hospital, community-funded hospital that is now looking, they're looking at privatising it, and people don't feel that that's right.
Where this is up to in terms of the process, there has been expressions of interest put up. I believe it's 4. They're being looked at by the government. If any of those are suitable and are value for the taxpayer, value for the community, they will then be considered in detail.
What's the actual motivation? You've got $200 million to spend on a public hospital to upgrade it yourself.
If we can get it built faster, and if we can have an expansion of health services, and it is value for taxpayers, then I think we as a government have got an obligation at least to look at it.
What will be the effect on health services and the health of people on the Central Coast with this public-private partnership?
What will happen is the same demands will need to be met with fewer resources, decreased working conditions for all the workers.
They do not want to give the community a choice. The question was directly asked, why not let the community vote on what is happening with the hospital and the service of health in this area? And they would not answer it.
What happens if there's no more public beds available? Will private beds be used? Or will public patients have to wait until a private bed becomes available?
If it went down the partnership model, the provider would be obligated to meet the same demand that we meet under the public provision.
Can you give us an example of a shining example where this wonderful PP has worked?
Look, my understanding is Northern Beaches is working well. I mean, it is still being developed. So you asked for an example. I'm offering that to you as an example.
You can't use something that isn't operating, that isn't proven, as an example, a shining example of what a public-private partnership is.
Well, the only model that they can show us that's working is one that actually has no patients, and it's a bit yes, minister.
We didn't really get any good answers. They fumbled around quite a lot and tried to avoid the questions.
There's just a lot of things in general that they can't commit to. We've been told that public patients will be treated as per normal with no hidden costs or extra fees. I guess that will be yet to be seen.
To make a profit, the private operator has to find a way to scale back on the costs. Now, the nursing and midwifery workforce of any health facility is the biggest workforce, so it's very appealing to either cut the numbers or cut the skills or cut both.
You're going to have a $4 billion surplus announced in a few days' time. You've got the money to pay for this upgrade. Do it and keep it 100% owned and run by the public.
You need to get to all the protests, you need to write letters to the government.
We will keep on campaigning. Nobody wants this.